Good evening, everyone. Today's topic is tubercular meningitis. So, neurotuberculosis is secondary to the hematogenous spread from the extracranial infection, most frequently in the lungs. So, the primary focus is lungs and it will spread through the hematogenous route. It will spread through the hematogenous route to the brain. So, there is development of the small TB foci, which are also known as rich foci, in subpial and subependymal surfaces of brain and spinal cord. Rupture of the rich foci into the subarachnoid space will lead to the tubercular meningitis. So the primary focus is the lungs. It has spread to the subpial and the subependymal surfaces, leading to the development of the rich foci. And when this rich foci will rupture into the subarachnoid space, it will lead to tubercular meningitis. If the rich foci will further enlarge in size, it will lead to the formation of the tuberculoma. It will lead to the formation of a tuberculoma. Next is, what are the imaging findings in tubercular meningitis? Basal cisterns are the most common site. In the first image, as you can see, temporal horns are dilated and the ventricular margins are blurred. So why ventricular margins are blurred? Because there is extracellular fluid accumulation in the subependymal white matter. As in the CT head, you can't appreciate the Sylvian fissures. So what is the location of the Sylvian fissure? Here. You can't appreciate Sylvian fissure because there is effacement of Sylvian fissures. Because there is effacement of Sylvian fissure. Because exudates have deposited in this region because of the exudates. Second image is CECT, contrast enhanced CT, and you can see thick enhancing exudates. So what is the finding? Thick enhancing exudates throughout the basal cisterns. So this is the area of the basal cisterns, and you can see exudates have deposited, and you can see in the previous image also the exudates have deposited in the Sylvian fissure, which has led to the effacement of the Sylvian fissure. So what is the characteristic finding in tubercular meningitis? Is the deposition of the exudates in the basal cisterns. This third image is MRI image. This is T1 post contrast. This is T1 post contrast image. And what you will see here, as you can see, there are so many exudates. Here, 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 everywhere it is exudates. So you can see enhancing exudates throughout basal stance, throughout basal stance, and subarachnoid spaces. The other finding you have seen, these ventricles are dilated. In the first image also you have seen the temporal horns are dilated. So hydrocephalus is very common in hydrocephalus is very common in tubercular meningitis. So what are the complications? Number one is the hydrocephalus. Number two is arthritis. Arthritis. So what will be happen after arthritis? It may result in ischemic infarcts. It may result in ischemic infarcts. If you are seeing ischemic infarcts in children, if you are seeing ischemic infarcts in children, it might be because of the tubercular meningitis. It might be because of the tubercular meningitis. And the third complication is the cranial nerves involvement. Third is the cranial nerves involvement. Sixth cranial nerve is the most commonly cranial nerve involved in tubercular meningitis. But second, third, fourth, sixth, seventh can be involved in tubercular meningitis. Thank you.